If you have fibromyalgia, you may at some point develop chest pain, and it can be confusing to tell if it's chest pain related to the chronic pain from fibromyalgia or if you're actually having cardiovascular disease. Now, of course, first, if you have sudden onset chest pain, you should go to the emergency room. If it turns out not to be an emergency type of chest pain, you definitely still see a cardiologist because fibromyalgia is associated with an increased risk of cardiovascular disease at a younger age than would be expected in someone who didn't have fibromyalgia. And that's thought to be for a few reasons. With fibromyalgia, you may get some sort of autonomic dysfunction, also increased inflammation, and you may be more likely to develop risk factors for cardiovascular disease. That's thought to be sometimes related to, the inflammation, but also not being able to exercise as much if you're getting a lot of pain from the fibromyalgia. And then you're more likely to develop high cholesterol or high blood pressure or diabetes, and those all can increase your risk of cardiovascular disease, unfortunately. But the important thing to do is prevention and try to prevent those things, from developing, and definitely get evaluated by a cardiologist if you have any symptoms. Generally speaking, if it is chest pain related to blockages in the arteries, it gets worse with exertion or stress and improves with rest or relaxing. But everyone doesn't necessarily have typical symptoms, and so that's why it's important to get evaluated. Also, if you feel, even if you're having muscle pain and it's restricting you from exercising, that can increase your chances of developing cardiovascular disease, as exercise is one of the main components of preventing cardiovascular disease. And so that's also important, to look into and see how you can best help yourself exercise more, because it is very important to help decrease the chances that you develop cardiovascular disease at a younger age.